So, hi everyone, it's Claire again doing a pre-record for our upcoming Wellbeing Week. And my guest today is Yvonne Whitehouse of Birdsong Yoga Physio. So, hi Yvonne, thanks for joining me today.
Hi, thank you so
Um,
much for asking me along. Good to
no,
see you.
thank you. I'm really looking forward to the main Wellbeing Week, but this is just a little sort of sampler, a little tease for people that's going to go up on our website. And we're going to be talking about what are generally the sort of most common asked questions to yourself about exercise and cancer. So I am going to hand over to you, lovely.
Thank you very much. So thank you for the introduction, Claire. There are questions that are often asked, particularly when considering exercise with a diagnosis of secondary breast cancer. And I think a lot of information out there, and it's sometimes difficult to find what you're looking for and where to get good advice. So I've asked about what people would like to find out a little bit more about. So we'll kick off with one of the first questions, which is, in general, is exercise helpful for bone health? So the answer to that is yes, a resounding yes. Throughout a diagnosis of secondary cancer, there can be different reasons why your bones might not be so strong. And that might be based on your age and natural aging. We know that women's bone density decreases naturally after about the age of 35. But we also know that for people with secondary breast cancer, depending on what treatments regimes that they are on or have been on, that can also have an impact on their bone health. We also know that breast cancer can progress to secondary breast cancer in the bones. So that can have a weakening effect as well. And I'll talk about that a little bit more in another question. So there's those things to take into consideration. So yes, particularly weight-bearing exercise or resistance training can be really good for bone health. It's also to do with the way that the muscles pull on the bones and can increase the cell regeneration within the bones as well. So a few different reasons why exercise is good for bone health.
I think that's good to know because I think a lot of people are scared about exercise when it comes to cancer. I think you're just scared that you're going to hurt yourself more, aren't you?
Yeah, and we'll talk a little bit more about specific bone metastases in question. Someone else asked, is exercise helpful for mental health? And I think again, yes, a resounding yes. So there's lots of evidence to show that exercise can be really helpful in mental health, and the government guidelines are around 150 minutes per adult per week of exercise or physical activity, and that is suitable across a population of people with cancer as well. That's been looked at specifically. There's the general benefits of exercise or physical activity, and that might be being outside and getting into fresh air and nature. It might be being with people and that social aspect of being in a team or being with friends when you're being active. It might also be more in relation to the type of exercise that you're doing. So you might just be doing something that you really enjoy. And we also know that there can be negative mental health impacts when people have a diagnosis of cancer. So if you're looking at potentially people having a decreased mental health, this can help boost it back up again. And there's lots of studies looking at sort of what things can make your mental health lower. And it might be that you've got pain from your symptoms. It might be to do with fatigue. It might be to do with anxiety around diagnosis or treatment. And exercise can help with all of those things when looked at specifically in a population of people with cancer as well. So yes, definitely good for your mood as well as good for your bones.
That's a good one. I think anything that helps the mood.
Yeah. And then somebody asked about exercise in relation to lymphedema. So lymphedema is a medical condition due to either having your lymph nodes removed through primary breast cancer surgery. So that's often under your armpit, and then you don't have good lymphatic flow into your arm, and you can end up with swelling in your arm as a result of that. It can also be due to, as cancer can spread, then there can be different causes that can affect your body's ability to move fluid around the body. and you can develop swelling as a result of that. So yeah, specifically for breast cancer related lymphedema, which is the type of lymphedema when you either had your lymph nodes under your arm removed or damaged through radiotherapy, then yes, exercise can be really useful for that. Lymph cells sit all over our bodies, just underneath the skin, and they don't have any ability to move by themselves. So if you're not moving, then your lymph cells can't move fluid around. So one of the benefits of movement is it helps the fluid just move between these cells in an upwards direction. It then can get picked up by these little buckets, these lymph nodes or glands, and redistributed around the body. So it's just a constant flow of lymphatic fluid. And if you've not got lymph glands in an area, or the lymph nodes have been damaged, then the movement is really useful to help get the fluid past the blockage or the absent area and picked up just back into your normal lymphatic system. So yeah, probably the types of things you want to avoid if you've got lymphedema are long holds, long static holds in one position. There was a lot of talk around 10, 15 years ago about avoiding doing really strenuous activity, carrying really heavy things where your muscles are held in that contraction. But lots of what we would call as physio with active range of movement exercises where you're moving the joint through a range is really useful. And the other thing we know is if we don't move limbs, then we can get a lot of stickiness around the joints, we can get really tight in the muscles and the fascia, and that makes it difficult for the lymph fluid to find its way. So a lot of yoga-based exercise is focused really on opening up through the chest and this lymphatic area over your chest, so that the lymph fluid can get its way out. Another benefit of exercise in terms of lymphatic drainage is also that you will naturally increase your breathing rate or take deeper breaths, depending on the type of exercise that you're doing. And there's lots of lymphatic channels that sit behind your diaphragm, abdomen. So you're utilising them as well, just through exercise. So yes.
I think, as you say, that's really useful as well. I used to suffer from lymphedema myself in the early days of my primary treatment. I always did wonder that about, what things are good for it and what's not. I think, as usual, there's just a level of fear that comes when you've got a cancer diagnosis. I think that you just don't want to make anything worse. So that's really interesting to know, and it's good to know that exercise does help.
Yeah, we would always prescribe exercise as one of the parts of lymphedema treatment for sure.
Fab.
And then there were a couple of questions quite similar, focusing around particularly spinal metastases. And one person had been told one thing by her oncologist, somebody else had been told something else, sort of looking at that risk of movement with spinal metastases. So spinal metastases is when your primary breast cancer has moved into one of your vertebrae. And I have a picture of the spine here, if you just bear with me a wee sec. So we can just look at this in a little bit of detail. So here we've got the cervical spine up here at the top, the thoracic spine here in the middle, and the lumbar spine. And this is us looking down on top of each spinal process here on the right-hand side of my screen. And then here on the left, we've got, the cervical spine up here at the top in the sort of maroony colour. Thoracic spine, a much bigger area of spine in the middle, so from the bottom of your neck to just below your bra strap. Your lumbar spine, the bit round about your pelvis, and then your sacrum, the bit that you can't really feel, which is down sort of your tailbone, your coccyx, in between your pelvis.
Okay.
And then over here, we've got looking on the side. So if I was standing sideways, this here is the front of my body, and this is the back of my body.
Okay.
So when we're thinking about spinal metastases, breast cancer often goes to this area, your thoracic spine most, because it passes, it's the way the venous channels pass through, and this is the most common area. I'll stop sharing just now and just come back to you. So what we're wanting to think about is the reason that these people have had differing advice or no advice at all is due to the huge different types of breast cancer within a diagnosis of breast cancer. So if you're thinking about wanting to start exercising, then there's probably some questions that you may know the answer to already, or you might want to talk through with your breast care nurse or your oncologist for you to have a real understanding of what's going on. And I think we talk a bit about patient experts, but how you can feel that you can make the right decisions for you is really based on knowing what questions to ask. So whether or not your breast cancer, your primary diagnosis of breast cancer is hormone receptor negative or positive would be one thing that would be useful to know. And then what types of treatments you've had in relation to that. So whether or not you've had something that's reduced your estrogen. So if we think back before, we were talking about bone density and menopause. If you've had something that's brought you into an early menopause as a treatment, then that might have an effect on your bone density. And whether or not you're taking a bone strengthener alongside whatever else treatment you're having will also affect the sort of density of your bones.
Mm-hmm.
There are different types of bone metastases. So bone can become cancerous in two or three different ways. One is called sclerotic or osteoblastic.
Mm-hmm.
One is called lytic or osteoclastic. And you can get a mixed picture as well. So dependent on which type of bone metastasis a person has, that will also affect the sort of sturdiness of the bones, the stability of the bones.
Okay.
And then thinking about where the bones are, so some areas are slightly more mobile, some areas of your spines are slightly more rigid. Those junctions between your cervical and your thoracic and your spine, your sacral spine, they're slightly differently structured as well. Impact. And then whether or what part of the vertebra is, I'll just come back to the share screen, what part of the vertebra is impacted by the tumour. So it might be, usually the tumour starts off in the body of the spine.
Mm-hmm.
Here, it might be that it's coming through towards the posterior column. And there are different scores that doctors can use to look at fracture risk or this instability of a spine. So oncologists can either use a norm score or the SIN score to look at that, and that can give a bit of an indication. Whether or not the bone has fractured or whether it is metastatic but stable, again, would have an impact on what type of exercise might or might not be appropriate. And another thing to think about is what type of pain you're getting. And I always say in my classes, you want to be guided by your pain. So if you're moving comfortably from side to side and knowing that you've got quite a stable spine and you're not sore, then very much carry on doing that. If you're moving either through flexion and extension, so coming forwards and backwards, or rotation your side to side, and you know that that aggravates your spine, then that's an indication that you don't want to do that. And cancer pain and bone pain in cancer can feel quite different to a mechanical cause of pain. So again, it's maybe having a chat through that with your oncologist or your breast care nurse to have a look at what medication you're taking, what type of pain is it, what's causing the pain. So the reasons why there are lots of different bits of advice out about there are because spines can be, and bone lesions in general, can be quite different in their makeup.
Yeah.
And that would have an impact on what type of movement and exercise you can do. So I appreciate that some people don't want to know a lot about the specifics of their cancer, but for people that do and want to be able to begin to exercise or move the best way for them, then those are the types of things that I would want to be having a think about with your healthcare team.
Yeah, that is really, really interesting, because I think I've got spine mets, and I often used to wonder, if there were specific things I should or shouldn't do as well. And I think having done some of your classes before as well, Yvonne, it's like it was interesting to know I think where there was pain and where there wasn't, and what was, in relation to the cancer, or just be gentle at movement. Like gentle movement was always fine. you know, but it was understanding the difference, if that makes sense, and
Oh,
obviously being very safe in what you're doing. But yeah, I think exercise can just be really scary for people who have bone pain because they're not sure if they're going to aggravate it or not or make something worse. And I think sometimes having someone help you through that can be massive because I think, as you say, exercise is really important, isn't it, in terms of trying to stay well. So yeah, really, really interesting. Um, and it's handy to know that those are the kind of questions that you should maybe ask your team because maybe I don't know that anyone's ever explained that to me before, so that's quite interesting.
yeah. And
Yeah.
they can tell that based on scan results that you've had. So
Yes.
they're able to look at whether it's a long bone, the top of your thighs and your pelvis, or whether it's your shoulders or wherever else. They can look at it and look how much of the bone is affected, a third to 2/3, or over 2/3. They can look at what type of lesion it is. So is it lytic or is it sclerotic? And they'll know about what medication you're taking and whether or not there's been any improvement in the quality of the bone as well. So yeah, there's a couple of different scores to look at fracture instability as well.
Fantastic, Yvonne. Thank you for that.
Measures. There is a good document that is probably more for healthcare professionals than for people to read themselves, although everybody's welcome to have a read if they wish. And it's by Macmillan, and it is the physical activity in patients with metastatic bone disease. And it lays out different types of exercise, and it could be something that if you're thinking you want to go to a gym, but somebody said, oh, I've not really worked with anybody with metastatic bone disease before, that could be something that they could have a read of to help them be informed about what type of exercise is appropriate or not. And it's really weight bearing versus non-weight bearing, rotation and torsion versus not. So it's got a bit of a guide as well.
That's good. I think I'll maybe try and put that link up on the website as well then if there's a link to it, but that's really interesting as well. And is there any other questions that people brought up on or
I think it was those four. So we've
those
talked
four
about
main
the
ones? Yeah.
yeah, there was a few questions around spine, mental health and lymphedema and bone health.
Brilliant. I think that's a fantastic start though, as I say, I think sometimes it's just starting the conversation about exercise and cancer and you know what's good and what's not and not to be scared of it, I guess. But I'm really looking forward. I know we've got an actual yoga session as part of our Wellbeing Week, which I'm really looking forward to. So I've got quite a few sign-ups already. So there's lots of people looking forward to it. So yeah, just as always, just thank you for being part of the sessions that Make Seconds Count do, but just for being part of the Wellbeing Week this year as well. I really appreciate it.
That's all, Claire. It's lovely to be part of it. And I think if this conversation that we were having today helps people think, oh, I wish I knew that, or maybe I could ask that, then we can pick up on some of those things in live
Absolutely.
sessions.
We could always revisit this at another time. If it's popular, we can revisit it anytime and carry on the conversation. So yeah, just thank you for now and I'll see you at the Wellbeing Week.
Great. Thanks very much, Claire. See you soon. Bye.
Bye.